Hi, I'm Chelsea, and today we're going to be demonstrating how to hang a piggyback IV. Okay, so in the med room we're going to prepare medication. So first we're going to check the doctor's orders, and he's ordered Rocephin, 1 gram. And when we look at our medication, we see that it comes as 500 milligrams per milliliter. So that means we're going to need 2 milliliters. I could also check my patient's chart and make sure that he doesn't have any allergies to anything we're going to be using. So then I'm going to prepare the medication. First, alcohol wipe the top of the bottle. Drop up 2 milliliters of air. Air into the bottle. Drop up our medication. Recap our needle for just a second. Then we're going to prepare our IV bag. So in that, alcohol wipe the site where we're going to insert our medication. Let it dry. And put our medication into the bag. Then we would disregard our needle into the sharps container. Alright, we would attach a label to our bag with the type of medication that we added, the amount, today's date, the time, my initials, the patient's name, and room number. Alright, then we can attach the tubing. And since the site is still sterile, we don't have to wipe it. Yeah, still comes out. Okay, just push it in there. Then we are going to unclamp and prime our line. Squeeze the drip down. Alright, and our line is primed. Okay, so now we are ready to go into our patient's room. Oh, we're also going to label the tubing with the date, time, and initials so they know when to change it. Alright, so we go in the room. Knock, knock, knock. I'm Chelsea. I'm going to be your nurse today. Can you please tell me your name and your date of birth? Great. Do you have any allergies? No. Okay, reconfirm with our MAR that this is the right patient and the right medication. Okay, so then we check the IV site, make sure there's no redness or swelling. Everything looks good. So we'll wash our hands, put on gloves. Alright, so we're going to lower our primary line. And then we're going to hang our secondary. Then we are going to clamp off our line into our patient. We're going to clamp off our primary. We're going to clean and wipe the port site that's closest to the patient below the clamp. Okay, then we're ready to attach our tubing. We'll unclamp here, unclamp this one. Okay, we're going to check the site one more time before we leave the room to make sure there's no redness, no swelling, no pain. We're not having any kind of reaction to the medication. We're going to check to make sure that our medication is flowing at 33 drops per minute, which it is. So then we're going to leave. We're going to come back. Okay, knock, knock, knock. I'm going to check the site again to make sure everything looks good. There's been no reaction to it. So then we're ready to disconnect our secondary tubing. So we will close off our secondary. Close off the one to the arm. Right, disconnect our secondary. We're going to save it so it can be used if needed at a later date and time. And then we can unclamp our primary and unclamp the arm. We'll make sure that it's flowing at the proper rate. Okay, excellent. We'll check the arm one last time. Make sure there's no redness, swelling, reaction to the medication. Everything looks good, so then we're ready to document. We'll document the drug that we gave, the amount, the route, the volume. We can either do that by milliliters from the bag or input and output, and confirm that everything matched as it should on the mark. All right.